This is our lung cancer staging system. So when we stage a person, the later the stage, the worse their prognosis is, right? So as we go from 1 to 2 to 3 to 4, the 4 is the bad one, okay? So you would expect patients with stage 4 disease, a very small percentage of them will survive 5 years. Patients with stage 1 disease, that'll be a lot higher. And we do that by looking at these. The T is the actual tumor itself, size, how much it's invaded into other structures. The N are lymph nodes. So those are sort of spread in lung cancer, spread in the chest to lymph nodes. And the M is spread outside the chest. And you can see that's actually the worst. And so the bigger the tumor, the more aggressive it is, the greater the stage. The more nodes that it has spread to, the higher the stage. And when it spreads outside the chest, the stage is 4, which is the worst, okay? So our goal would be to catch people with CT screening in this early stage, when they're stage 1 or 2, before it's gotten very big, before there's lots of nodes that it's spread to, and before they've had metastases or spread outside of the chest. And these are the number of patients who have, again, the patients who are diagnosed with that particular stage at 5 years. How many of them are still alive? And you can see that when you have spread outside the chest, only 1% of them are alive at 5 years. Whereas if you have a very early stage, over 60% of them are alive at 5 years. So this is a really great opportunity to be able to catch these patients in the early stage, because then you're going to be doing a lot of good for them, obviously.